and happy holidays from Mother to Baby. My name is Amanda De Leon, and I am with Mother to Baby. While the holidays are a joyous time filled with lots of celebration, we know that sometimes they're overwhelming, especially for folks who are pregnant and managing health conditions such as lupus and their treatments. So we will be discussing lupus, its treatments in pregnancy today. And while our information shouldn't replace that of advice from a medical professional, we hope that it can provide some comfort in the management of these conditions during the holiday season. Joining us today is Robert Felix, a Teratogen Information Specialist from MotherToBaby California. Thank you for joining us today for this conversation.
Right. Well, thanks for having me here. This is really exciting to be able to share the services, the free resource that MotherToBaby provides, and also share about the studies that we do that could benefit individuals and future pregnant people.
So let's start with, what is lupus?
So lupus is a chronic autoimmune disease that occurs when the body's immune system attacks the organs and tissues. And then this attack, what happens is it starts to cause inflammation. And in that process, it can then actually start damaging parts of the body. And, anybody can get lupus, but it seems to be that it's more common in women, usually between the age of 15 to 45. And then they see it commonly occurring among African Americans, Native American Indians, and Asians too.
So regarding family planning, what should moms-to-be with lupus consider when planning a pregnancy?
Well, like any other condition, before pregnancy, you want to be in good health. So you want to control it. And generally the idea with anything is trying to be healthy at least 3 months, maybe 6 months before getting pregnant. And so the secret to that one is knowing your body and knowing, are you in good health? Are you taking a medication that's controlling your condition? So talking to your rheumatologist or maybe your primary care to see what you need to do to get to that level of being as healthy as possible. And of course, there are medications that can help, and perhaps medications that a person might be on already is controlling them. So then the question is checking in with the provider, are these medications going to be safe during the pregnancy? So kind of getting doing homework and getting the background is the best thing to do, because oftentimes when we talk to women at MotherToBaby, they're calling us and they just found out they're pregnant and weren't planning. And so now they're concerned because some medications may or may not be a concern during the pregnancy. So the ideal is to be prepared.
Great. That kind of goes into the next question that we have. How might lupus and its medications impact a pregnancy?
Well, there are many medications that are used for treatment of lupus, almost like any other condition, like say asthma or arthritis, and these medications, there are medications we know that women have used before getting pregnant and continue to use during pregnancy and are not known to increase the risk of the pregnancy. But then there are some medications we know may. And that's the difficult part, is sometimes we don't know much about them because there are no good studies that have been done in pregnancy. So again, as I mentioned earlier, the idea is to be able to prepare and talk to your healthcare provider about what you can do to prepare yourself and minimize any potential risks. Because, in every pregnancy, there's a background risk as it is, and it's anywhere from 3 to 5%, and that's without any exposure. So the idea is you want to limit that increase of any risk with any exposure, medication or otherwise.
Great. So with the holidays come seasonal changes, travel, fluctuations in the weather. How might this be particularly challenging for folks who are
Yeah,
pregnant with
so,
lupus?
during the holidays, of course, there's so many things going on, and then also where you're going to be flying or traveling to. And so, like the time change, and if you're controlled on the medication at a certain cycle, you want to see how you could work that. So, working with your provider about the medication and how that it could impact when you change for time, and then taking consideration risks or stressors relative to what occurs during the holiday. Because then if you are exhausted, maybe that could affect your body, which then, for somebody who may have lupus, could potentially have a flare up. And so, really preparing yourself and your body and making sure you have your meds or whatever treatment you're using, so ahead of time, or you're prepared ahead of time.
Great. So that's all the questions we have. Thank you for discussing this important topic with us. We know that the holidays can be overwhelming, and MotherToBaby is here to help at every step. Patients and healthcare providers can find free research based information about lupus and its treatments on our website via fact sheets and information hubs. We're also enrolling in research studies looking at lupus in pregnancy, as well as Benlysta use for the treatment of lupus.
Well, it's wonderful, and I think everyone should take advantage of the services that MotherToBaby provides. Anyone can call, chat online, text, maybe even email and ask their question. And I encourage everyone, anyone of reproductive years. It's funny because we go out in the community and oftentimes people say, "No, I'm done with pregnancy," or "We're not planning a pregnancy." And I always say, well, it doesn't matter. What matters is be aware that there's a service called MotherToBaby who can provide you any information. So instead of going to Dr. Internet and getting misinformation, MotherToBaby provides the latest up-to-date information about exposures in pregnancy. And you mentioned research. It's not like you can easily do clinical trials in pregnancy. Who's going to want to say, okay, well, let's gather 500 pregnant women and expose them to drug X and see what happens, right? But we know that people out there, and many more women, are getting pregnant later in life, in their reproductive years, because they're having a life. And at that point, they develop more conditions where they're going to need to take a medication. And so, we don't know a whole lot of information on many medications. And so research is important. And so this is what we do at MotherToBaby Pregnancy Study. We take advantage of the situation that if someone has had the exposure, we'd like to be able to follow that. So we encourage moms who have had an exposure, or sometimes it's just moms or individuals who didn't have an exposure but have a condition. And we would like to learn from that, so that we could provide better information, not only to their clinician, but to future pregnant moms. And perhaps it would be for their future pregnancy as well. And, for research purposes with lupus, MotherToBaby is currently doing a study on Benlysta. So we're quite excited. I know at the last rheumatology meeting and the guidelines that's being revised, they talked about the efficacy of Benlysta for lupus nephritis. So perhaps with this changing guideline, there may be more people who are going to be inclined to take Benlysta even if they get pregnant. But we don't know that. We'll see what happens.
So where does MotherToBaby get their information to help counsel questions about pregnancy?
That's a good point. And considering like I've said, that most medications we know nothing about. So what is it that MotherToBaby provides? So MotherToBaby, what we do is we use a lot of different resources, data, online databases, publications, and a variety of partners we have throughout the world who are doing studies on certain conditions. So we evaluate the literature, and then we come up with a summary of that literature. Anybody can do that research, but the problem is, or sometimes the difficulty is trying to, if you're not an expert at it, how to interpret the information and then be able to provide it to your patient. So we have the latest up to date. A lot of providers use our service. They now will chat online or email the counselors and ask them, what do you have the latest on XYZ? Other providers will say, well, we have resources that are up to date. And it's great that they do, but I also caution them because a lot of the online databases don't get updated. There's a lag time. And so, whereas with MotherToBaby, our data is updated almost regularly. In fact, back in the day, we used to evaluate up to 80 medical journals a month to see if there's anything new that's being publicized, or if there's anything new known about the medication.
Can you tell me a little bit more about your pregnancy studies?
Yeah, so it's this study, as I mentioned to you, the research part. It's an interesting study, protocol or process. So we talk to the mom, we develop a rapport, and we hope that through that conversation, we are able to encourage them to participate in the study. And when they participate in the study, it's really simple. They don't have to come and visit, nor do we have to go over to where they're at. And it doesn't matter where they're getting any care or prenatal care. What we do is we do a parallel study where they can continue to do everything that they're doing. We just observe them and we keep in touch with them. So the study involves contacting the individual anywhere from 1 to 3 times during the pregnancy. And then we contact them after the baby's born. Now, depending on the study or the medication of interest, some studies we will look at birth outcomes, like was it a live born, was it a miscarriage, what went on, was it a stillbirth. Some study will go beyond that to like maybe a year and follow not only what the outcome is, and we also look at breastfeeding, if the mom is taking that medication and is now breastfeeding the baby. Other medications, like we've done in the past, where we would follow kids long term, because there are some medications that are known to cause long-term effects. So we've followed kids up to school year age. So it depends on the study, but we really encourage everyone who call to participate in the study. And it really is no more necessary visits that they need. It's just all through telephone.
So thank you so much for joining us today to have this discussion. The key takeaways that I've gathered from this conversation are that navigating lupus in pregnancy doesn't have to mess with the joy and celebration of the holiday season.
And that goes for lupus and any other condition, really. It's just nice to be prepared ahead of time so that when the situation arises, the pregnancy, you're prepared, and you could minimize concerns. And thank you for having me here.
Yeah, you're welcome. Don't forget to subscribe to our channel and share some resources with your loved ones. Bye. Thanks for joining us. We'll see you guys next time, and have a great holiday season.